My guest this morning on Jersey Magazine is Dr. Rhonda Randall. She is the Chief Medical Officer, United Healthcare Employer and Individual. Dr. Randall, good morning and welcome to Jersey Magazine.
Good morning. Thank you for having me.
I know that we are seeing a rise in cancer rates lately, particularly in younger ages. What do you think the cause of that is?
I think it's two things. The first is our lifestyle, and the second is earlier detection and better methods of detection.
What about lifestyle is affecting things the most, do you think?
So some lifestyle choices like smoking, heavy alcohol use, not eating a balanced diet, getting too many processed foods, too high in sugar, having a sedentary lifestyle. These are all known risks for increased risk for cancer. There are some things that we can't modify, like genetics and family history, of course.
You, of course, mentioned smoking right off the bat. And over this past weekend, my family and I took a trip, and it was the first time I had looked at a price of a pack of cigarettes lately, and it was close to $15 in the convenience store that we happened to be in. And Dr. Randall, I was floored, A, by the cost, and B, the fact that people are spending this much money to do something that we know sooner or later is going to hurt you.
Yeah, the risks of many types of cancer increase significantly if you have a smoking history. And the other thing that the good news is in our nation as a whole, we have seen the use of cigarettes come down over the past several decades. But in the last few years, we're unfortunately seeing that replaced by vaping.
What are some of the things that we need to know about cancer rates at any age, whether young or old?
So, probably a prominent one is colorectal cancer. So, we saw the ages of individuals who are developing colorectal cancer start to come at younger ages, which led the United States Preventative Task Force changed their recommendation. Now the recommendation is to start screening for colorectal cancer at age 45. The good news is that there's a lot of ways to detect that, including some non-invasive ways. So there are tests that you can do at home with your stool and send it into a lab and have that first preventative screening done. For example, breast cancer is another one. Most women are to be screened at age 40. But some women who are higher risk, the recommendation is to start screening at 35. Just a couple examples.
How much does family history play into all of this?
We know it is a factor. For example, for some women who have a history in their family of a first degree relative who has one of the genes that we know are associated with forms of breast cancer, right? There's recommendations for screening for that gene when you know that family history. There's also recommendations sometimes to start screening earlier if you have a first degree relative who's had colon cancer at a young age, for example.
What are some of the differences between preventative and diagnostic screenings that our listeners should be aware of, Dr. Randall?
Yeah, that's a really important question because it can be so confusing, right? We go to the doctor, we think that we're there for a screening test, take the colorectal cancer screening, for example, and now your test is positive, your non-invasive test has blood in your stool, or your colonoscopy shows that you have a polyp, and all of a sudden you get a bill for a diagnostic test. So, in healthcare, we want to make sure that isn't a barrier, so that there's not a surprise when you're getting that bill from your doctor. So we're covering your first diagnostic breast image or your first diagnostic colorectal cancer screen, and under the same benefit as your preventative screening.
We mentioned smoking a little bit earlier. What are some of the other lifestyle changes or choices that people should be aware of?
So eating a balanced diet is important. I really encourage people, rather than give you a prescription of what you shouldn't or shouldn't eat. We kind of all have, we know what that is. I don't need to preach, but be a label reader, right? Read what you're eating, understand what the ingredients are, what's processed food, limit that. Allow yourself to have a treat every now and then if you want to, but make sure that you're getting good information on what you're including in your diet. A little bit of movement goes a long way. So you don't even have to consider it exercise, but 30 minutes of a walk every other day can be terrific for your health and lower your cancer rates. And then staying up on preventative care, having a personal relationship with a physician who can understand those risks and be honest with your physician. If you are a smoker, if you are using alcohol, if you're vaping or using marijuana, like all those conversations that you need to be honest with your physician are important to understanding your risk and that early detection and prevention.
We're hearing a lot of talk these days about Medicare and Medicaid and what may be cut, what might not be cut. What are some of the new benefits helping to improve access to care, Dr. Randall?
Well, the preventative care one has been around for a while, right? So, excuse me, for these things like cancer screenings, the annual visit with your physician, checking for things like high cholesterol, high blood pressure, getting your routine immunizations and vaccines, for example. All of these preventative things are covered with $0 copay.
And for listeners who want to learn more, Dr. Randall, where can they go?
They can go to uhc.com.
All right, Dr. Rhonda Randall, the Chief Medical Officer, United Healthcare Employer and Individual. Thank you so much for your time this morning here on Jersey Magazine.
Thank you. Be well.